So, what is sleep paralysis, and could it be something that a normal person can experience? I'm Dr. Andy Berkowski of ReLACS Health, and today's topic is sleep paralysis. So, sleep paralysis is actually the body's inability to transition from being in the stage of rapid eye movement sleep or REM sleep into wakefulness. So, normally during REM sleep, the body is essentially paralyzed. There's a signal that comes from the brain that prevents the muscles from moving. In part, we think maybe to prevent us from acting out our dreams. And there are conditions that patients act out their dreams. But in sleep paralysis, what happens is the brain begins to wake up from sleep, but the paralysis remains. So you basically feel like you're trapped in your body. You can't move your arms and legs, but you feel like you've woken up. This can often be associated with different types of hallucinations, which are called hypnopompic hallucinations, where you might feel or smell or hear something in the room or feel like a presence is in the room as you're coming out. And it can actually be quite distressful or anxiety provoking. However, sleep paralysis, which is commonly thought to be associated with narcolepsy type 1, is not all that uncommon in just normal individuals without narcolepsy. So some estimates have it at maybe 15 to 40% of the population has at least one episode in their lifetime. I know I had one about 4 to 6 weeks ago, so I get them. I know it's not very pleasant. The main triggers for sleep paralysis is disruption to the sleep schedule. People who are on erratic sleep schedules tend to get more sleep paralysis, and maybe that's why we see it more commonly in teenagers and young adults, because their sleep schedules are not as stable as middle-aged or older adults. Another thing is hitting that snooze bar. Your brain's going in and out of REM sleep at the end of the night, which is REM sleep is more common at the end of the night, and you're more likely to have an incomplete transition from being awake to being asleep. So in all, sleep paralysis is something that many people experience. It is not due to only narcolepsy, although in narcolepsy type 1 patients can experience it quite frequently and it just never gets better. But typically, keeping good sleep hygiene, waking up at the same time every day, and not hitting that snooze bar, those are probably the best ways to avoid having sleep paralysis from time to time. As always, this video is for general medical information purposes only. It does not constitute the practice of medicine, and all medical decisions should be made under the supervision of a licensed medical professional. And as always, one of the keys to sleeping well is to relax.